Okay, it's 10 a.m., so we're going to go ahead and get started. Good morning, everyone, and thank you all for tuning in to today's webinar. My name is Alana Krober, and I am the 2-in-1 Director of Information Services. I'm tag teaming this webinar today with my coworker, and I'll let her introduce herself.
Good morning, everyone. My name is Annie Scully, and I work in United Way of Connecticut's Community Results Center.
Okay, so we are taking a bit of a different approach and format with today's webinar, which is focused on frequently asked questions. 2-in-1 Connecticut has been connecting residents to important community resources for 43 years. Despite our 4 decades of service, though, we know there are people who still have never heard of us, and we know that even those who are familiar with us, so even local nonprofits, legislators, state agencies, foundations, still often have questions about the various roles that we play. So in this webinar, we're going to take a stab at answering some of the questions we most often receive in the hopes of providing you with a better understanding of 2-in-1 Connecticut. So the common questions we'll run through today are, do I have to call to get help? How quickly will my call be answered? What kind of help is available? What if there are no resources available? How can I access shelter or housing? Is the information in the 2-in-1 database updated? How can I use 2-in-1 to create my own resource list or directory? Why don't more people know about 2-in-1? And as you see, the plan is to leave ample time at the end to answer other questions that any of you might have. Because we are really just focusing on this list of questions today, we will not be giving a full overview of 2-in-1 or doing a demo of the website, but you can head to our training page and watch some of the recorded webinars there for that kind of background. All right, let's get started. So our first question, do I have to call to get help, or is there another way to connect with you? So this is a question we have been receiving more and more frequently over the past 5 years as folks increasingly expect to be able to connect electronically or via other technology platforms. I do want to be really clear that regardless of what other platforms we bring on, folks will always be able to reach us by phone 24 hours a day, 7 days a week, 365 days a year, either by dialing 211 or alternatively 1-800-203-1234. That has not changed. But at the same time, we have also been working hard to give people other ways to connect with us for help. We want to have as many channels available to help seekers as possible. So individuals who still want live one-on-one assistance can now chat with us Tuesday through Friday, and the link to that live chat option is on the top of the 2in1ct.org homepage. For individuals who prefer self-service, so these are often professionals or help seekers who in a Google world are used to doing a web search as a first step, they can search for information and community resources on our website, 2in1ct.org. In 2014, we completely redesigned our website and search engine, and it's now more user-friendly and intuitive than ever. It can be translated into 30 languages, and it's mobile responsive so that it can work on any size device. We've also recognized, however, that not all web users know what they need or what they're looking for or what kinds of help are available. And so for those individuals, we've built some online screening tools to help them begin their search or their help journey. So the 2-in-1 Navigator is one of those tools, which can be accessed at 2in1navigator.org, and it screens someone for potential eligibility for 23 state and federal benefit programs. And our Healthy Lives Navigator, which is available prominently on our homepage, screens someone for 11 social needs that are often associated with poor health outcomes, and then provides them with a list of community resources to address those needs. And lastly, we've been starting to offer some automated text for resource campaigns with the goal of offering live two-way texting in the near future. Okay, so next question. If I do call, how quickly will my call be answered, and what if I have an urgent situation? So this is a question that we get a lot. Understandably, people are concerned about wait times and they want to know what to expect. And we are a call center, and we are a busy call center. In recent years, we've been averaging about 300 calls a year, and approximately 50% of those calls are from individuals in some sort of crisis. Those calls are complex and they take a lot of time. And this means that yes, sometimes there may be a wait when you call, but we know when those busy times are typically, and we've been doing our best to message to our partners about when to call to avoid those high traffic periods. So call volume and subsequently wait times are typically highest on Mondays, especially Monday mornings. So if possible, we tell people not to call then. People don't always realize, or sometimes they forget, I think, that we're open 24/7, which means someone who calls before 8 a.m. or after 6 p.m. will most likely not experience the same wait as someone calling at 10 a.m. or 2 p.m. Similarly, someone who calls on a Wednesday or Saturday will most likely not experience the same wait as someone calling on a Monday. But regardless of what day or time someone calls, we do offer an option so that they don't have to wait on hold or use their cell phone minutes. And this is a callback option where callers can opt to have us call them back when someone's available instead of waiting on hold. And so now the second part of the question, what if I have an urgent situation? This part's really important. And like I mentioned before, about half of the calls we take are from individuals in some sort of crisis situation. They may be suicidal, they may have no heat or electricity, they may be in a domestic violence situation, they may be homeless, they may be a parent with a child in crisis. We let the caller define whether or not they are in crisis. And the way that our call management software works is that crisis calls always get prioritized. This means that those calls always get answered very quickly. So the big takeaways here, our big messages are, if you are in an urgent situation, your call will get answered quickly, regardless of what day or what time you call. And if you're calling for non-urgent needs, you can avoid potential wait times by calling at times other than Monday peak hours, or by opting for the callback option.
Thanks, Lana, and hi everyone, this is Annie once again. Our next question is, what kind of help is available? So as Lana spoke to earlier, there are multiple ways that you can communicate or access our 211 contact center to get the connection to the help and the service that you're in need of. So in addition to visiting our website or dialing 211 to be connected with our vast information and referral database of community services and programs across the state, United Way of Connecticut also offers connection to a number of specialized services. So we're our blended contact center, which means that individuals that are in crisis can dial 211 to be connected with the suicide hotline. Individuals can also dial 211 to be connected with the Coordinated Access Network for housing and shelter, which I'll speak to in a little bit more detail later on today. We also serve as the front door for the state's Youth Mobile Crisis Intervention Service, which is the central intake for that service. It's a 24-hour service that helps individuals or youth in crisis be connected with a 211 contact specialist, and then with a clinician to be dispatched to the location of that individual and then work with that individual to create a care plan moving forward. We also are we have a specialized program known as our Child Development Info Line, which helps parents connect to services for children that may have a suspected or diagnosed developmental delay. That Child Development Info Line also serves as a central intake for our Birth to 3 service across the state, into the Help Me Grow program, which provides access to the Ages and Stages questionnaire, which can help track your child's development. We also have a 211 child care program, which helps parents navigate through the various options of child care across the state. Just like our 211ct.org website, our 211 child care website has a high-tech website that will allow you to filter through the various options across the state. And like I said earlier, we have a database of more than 40,000 programs and services that our contact specialists are trained on how to navigate through to help provide referrals to programs and services. So how do you know where to refer people to for help is the second part of this question. And our 211 contact specialists work across 3 shifts, and they go through rigorous training to become comfortable and knowledgeable with the landscape of various health community service programs across the state. They're also trained to do active listening so that they know sort of how to poke and prod to find out what some of the underlying needs are for that individual. So we say that we field about 250,000 calls each year from individuals across the state of Connecticut, but those individual calls result in even more requests for service. So a single call can result in multiple service requests, and our contact specialists are skilled in identifying what some of the underlying needs to each one of those calls might be. So if I've recently lost my job and I'm calling for connection to employment services, or because I want to go to a resume building workshop and need to find out where those are offered across the state, my contact specialist that I'm speaking with will likely ask me if I lost my health insurance because I lost my job, and am I having trouble providing food for my family because I lost my job. So that one request for job finding assistance might result in multiple service requests. So what happens when we're not able to meet a caller's needs? So what if there are no resources available? And so resources needed to meet callers' needs may not always be available. Like I said earlier, our contact specialists are highly trained, and in addition to navigating through the landscape of health and human service programs offered by our community providers across the state and tapping into some of the specialized services offered here at United Way of Connecticut, they're trained in to help our callers sort of navigate other sort of natural support. So family, friends, faith-based organizations that can help to provide the services or meet the needs of those individual callers. When our request for service is classified as unmet, that means that there is no resource in our database and that there are no natural supports that our contact specialists are able to connect those callers in need to. So we classify a request for service as unmet when there is no program to refer a caller to, or there is no service to meet that caller's need. And our unmet needs are tracked, and information about unmet needs is made available in real time on our 211 Counts data dashboard. So that you can access by visiting ct.211counts.org. As I said, it's an online real-time data dashboard that provides depictions of all of our call center data. So it's a free public online dashboard, and it provides real-time searchable visual presentations of our call center data across 13 top service categories and 76 subcategories. So it allows you not only to look at the top needs from your community, but you can also filter that data to show just that the data for your specific zip code or your town, but you can also look individually at the top service requests and drill a little bit deeper into those. So in addition to just housing and shelter calls, what were those housing and shelter calls for your town or your city or your district? Once again, you can access that dashboard by visiting ct.211counts.org, and we're hoping that this call data can be used to demonstrate the degree to which services are needed and help to direct the deployment of resources to meet those needs. Stakeholders, city planners, community health foundations, elected officials, and just interested and concerned citizens have used that data to get a better grasp on what the most pressing needs are for their communities. And so how can someone access shelter or get help with housing? As I mentioned earlier, 211 is the front door for the state's coordinated access network. So if you're in need of shelter or experiencing a housing-related crisis, you can dial 211 at any time, select option 3 and then option 1 to speak with a contact specialist. And our contact specialist will then assess a caller's situation and provide initially shelter diversion options. So tapping into our database of community resources, asking the caller about any natural supports, friends, family, faith-based organizations that they might be able to reach out to help them in this time of need. But if there are no resources available and there's no way to divert that individual from shelter, our contact specialist will then start the process of scheduling a CAN appointment in that caller's region. So all these appointments and the protocols we follow are based on individual regional CAN providers that design those protocols for their region. So we'll schedule the caller for a regional CAN appointment to meet with a homelessness provider. If it's an emergency situation, we'll refer that individual to emergency shelter as needed, and once again, based on guidelines that are provided by the CAN in that caller's region.
Okay, so the next question is the information in the 211 database updated? And so the short answer to this question is yes. The longer answer to this question is that it is as updated as it can be given a whole variety of challenges, including difficulty sometimes reaching agencies for updates. So the 211 database of community resources is really big. So it's about 75,000 resource records, and all of those have to be maintained and updated. And we're an accredited information and referral center, and as such, we have a team of 6 full-time resource specialists who reach out to each agency once per year to do a thorough review of all of their program listings. And sometimes it's not easy to reach the agencies or to get their updates back, which is hard. And we get it. We know how time-strapped some of the nonprofit organizations in our database are, and it does take some time to review the listing and provide us with updates. So we've also been working really hard to make it quicker and easier for anyone. So the agencies themselves, clients, or other professionals to tell us when information has changed. We get these interim updates all the time, and we are able typically to verify them and make the change in the database within a day. And we will always continue to proactively reach out to agencies every year to do a formal review, but our goal right now is really to have the community at large feeding us updates all the time so that the database is as updated and as current as it can be. So to this aim, we've added an Update This Listing button to each program listing on the 211ct.org website so that anyone can send us a note right from the website. And if they are logged into their My211 account, they can even publish a note in real time to that listing about the change, whatever it might be. The hours changed, the address changed, a program closed, eligibility changed, so that all web users can see that note. We are really encouraging our community partners and everyone to use this feature and stay in constant communication with us because the information in the database is only as good as what we receive. All right, second to last question. How can I use the 211 resource data to create a listing or directory for my community, clients, patients? So I get this question or this request a lot. Individuals or groups or communities or agencies are always interested in taking the 211 resource database, which is big, and narrowing it down to create a listing or directory that is customized for their client or clients or target population or geographic area or issue area. And this often makes a lot of sense. And we love that people come to us and want to use the 211 data instead of recreating the wheel. These groups recognize how difficult maintaining their own resource directory would be and are looking for ways to point to the 211 data, which is continually maintained. We work with partners on these requests all the time, and there are a bunch of different solutions or options depending on the goals or the scope of the project or initiative. So sometimes it's as simple as training a group on how to register and use a free My211 account to create and save a customized resource list for an individual or for a service like food resources or transportation resources or for a geographic area. We show them how each of those resource lists can be its own directory and how each one has a shareable URL that can be embedded anywhere. Sometimes these initiatives or these projects involve us giving a group an export of a slice of the database so they can, in partnership with us, create a specialized product for their community. So the New Haven Food Assistance Resource Guide, which you see a snippet of on this slide, is a good example of that. Other groups like the AgeWell CT website and the MyPlace CT website, they have embedded specific hyperlinks to our 211 website for listings of certain programs. Some municipalities, like New Haven and Waterbury, have built microsites for their community using, in large part, electronic links to the 211 database. And other projects involve the integration of our full resource database into another software platform entirely, like Network of Care and Unite Us. Okay, so hopefully that gives you kind of a sense of the gamut of ways and the variety of ways in which you can use 211 data to create your own customized listing or directory of resources. And at the end of this presentation, we're going to have our contact information. So for those of you who are interested in this more, or this has been one of your questions, please feel free to reach out directly to myself or Annie. And now Annie's going to take the last question.
Thanks, Lana. So last but certainly not least, why don't more people know about 211? So I can't tell you how many times I've been in front of a group of community providers or been among elected officials where they say, you know, my constituents or the people that I serve, they don't know about your service and you provide a great service. How can we raise awareness about 211? So that's a really good question and something that we're hoping we can ask all of you to help us with today. So first and foremost, please refer the individuals you serve to 211. We're a 24/7, 365 service. There's multiple ways to contact our database and our contact center. We have a continuously updated database of programs and services that can serve individuals across the state of Connecticut. So remind those that you serve, those that you work with, your friends, your family members, that they can dial 211, visit 211ct.org, text us or chat us to gain access into the variety of community resources across the state. We also encourage you to visit our website, 211ct.org, and click on the Professionals tab at the top of the page to order free 211 materials. There's an online form right on that page. You can click on it, select the materials you want, tell us how many you want, provide your name and address, and we'll mail you those materials for free so that you have them on hand to display in your lobby or to provide to the individuals you work with every day, so they have some written materials about how to contact us and about the services we provide. We also encourage you to put a link to 211 on your organization's website. So it's very easy. You can hyperlink it right off a homepage or right off a page that has to do with how to connect to community services or community programs across the state. So using that option is another great way to raise awareness. And finally, we encourage you to sign up for and share our monthly publications. So every month, 211 Connecticut puts out 2 monthly newsletters. The first, which is we've been putting out for a very long time, is called our Community Connection, and that highlights some events and some timely topics across the state. So our most recent publication talked about cold weather and utility assistance. It talked about ways to save money on heat this winter, some tips and tricks offered by various e-library papers that we maintain. A lot of times those community connections will link to outside websites and outside sources, as well as back into our database to provide referrals to different programs and services listed in our database. So that's our Community Connection. Our second monthly newsletter is just over a year old, and it's called our 211 CT Data Glance, or Data Glance. And that highlights additions to our 211 database. So every day, Alana's team of information services professionals is updating, is pruning, is maintaining this living, breathing database that we have here at 211 to make sure that we're reflecting the needs of community members across the state. So that publication highlights some of the recent additions to our database. It doesn't mean they're new to Connecticut, but they're new to our database, so it's a great way to see maybe what's been added or what's changed in our database. And finally, just as a reminder, we receive generous funding from the state of Connecticut and from our local United Ways, our 15 local United Ways scattered across the state, but we do not have a marketing budget, which is why sometimes you won't see that billboard or won't see that advertisement or won't hear on the radio, dial 211 if you need help, unless there's specialized pockets of funding to provide for that work. So we really do rely on our agencies and on our partners across the state to raise awareness about the service we provide here. So we really appreciate anything you guys can do to help us get the word out about 211. So we have about 5 minutes left in today's presentation. We want to thank everybody for tuning in today and encourage you right now to go ahead and chat or use the Q&A option to ask questions. Everyone is in listen-only mode right now, so if you have a question, you can hover over the toolbar at the bottom of your screen or top of your screen, depending on where you have it placed, and go ahead and use that Q&A or that chat option to ask us questions, and we'd be happy to field any of those at this time.
So like I mentioned earlier, Annie and we have our contact information on this slide. So if you don't have any questions that are coming top of mind right now, please don't hesitate in the future to reach out to either of us. Should you have any questions, should you want more information about anything we talked about today, or should you have sort of, training requests for yourself or for your organization. And I do see, so one question is just about having the slide deck emailed. Yes, we will be following up and sending out an email later today or tomorrow with the slide deck, as well as a link to the webinar recording. And all of the webinars that we do in our various webinar series, all of the links to those recordings are on our professionals page. And from there, if you go to the outreach and training page, you'll see a list of all the recorded webinars, and this one will be there too in the next day or so.
We received another question about how to access shelter via the Coordinated Access Network if someone does not have access to a phone, which is a great question. So typically you do have to dial 211 in order to start the process of scheduling a CAN appointment. If you can work with an individual to lend them a phone or to provide them public access via a community center or a library to use a telephone, that's a great option. They also have the option to chat. They can chat in Tuesday through Friday, 8 to 4, I believe, and those chats will go right to one of our contact specialists that can start that process. Unfortunately, there's not a way to do that just on the 211c.org website by searching for housing resources. You have to either chat or call 211 in order to start the coordinated access intake process. So now we have a question: what is the biggest need that is not met that goes on the list of unmet needs? So that's a really great question. And what I can do right now maybe is jump right onto our 211CT data dashboard called 211 Counts to show you guys how you can answer that question independently, but also we can show you how to get there ourselves.
Yeah, so while Annie's bringing up the data dashboard, I'll just make a note that unmet needs really vary by community. So the top unmet needs in one community might look very different from the top unmet needs in another community. However, when we look at the data from a statewide perspective, right, so looking at all the calls that come in from around the state, one of the top unmet needs for the last several years is around rental assistance. So Annie just brought up the data dashboard now. We're looking at the last 365 days worth of data, right? So the last year worth of data. And you can see, again, this is statewide, that about 29% of all the requests we took over the last year were for housing and shelter. We're looking at the actual counts right now, 91,000 requests for housing and shelter needs. And then to the right, you'll see the subcategories within housing and shelter, right? So how many requests for sort of shelter, how many for low-cost housing, rental assistance, mortgage assistance, and so on. And even further to the right, there is a column that indicates of those requests, what percentage were unmet. And you can see rental assistance sticks out far and above the rest of the housing requests, right? 75% of the requests we got for rent payment assistance or for assistance with a security deposit were unmet over the last year, which speaks volumes about the availability of those types of resources and programs in our communities right now, especially since the closing of a statewide program several years ago. So again, that's one example from a statewide perspective, but as you drill into this dashboard, as you look at your town or your zip code or your county or your state House district or state Senate district, you'll see that those unmet needs may vary, and rental assistance might not be an unmet need, a top unmet need for your particular community, but something else might be, perhaps something around mental health or healthcare or utility assistance.
Great question. And once again, we encourage you guys to check out the data dashboard, ct.211counts.org, to dig into your local community needs and call data. Are there any other questions? I'm going to go ahead and send that link out to everybody. So if there's no more questions, I'll just leave you guys once again with our contact information. As Alana said, please don't hesitate to reach out if you want to learn more, if we didn't answer one of your most frequently asked questions or a question that you receive from people that you serve. 211 is a 24/7, 365 service, so please tell those that you work with that if they're in need of connection to services, that they can always dial 211 to speak with someone that can help them meet their needs.
Great. Thanks, everybody, for tuning in today. And like I said, we'll be getting you out the slide deck and the recording of the webinar in the next day or so. Okay. Have a great day.
Thank you.
Bye.